The very latest in the coronavirus crisis, some truly staggering numbers. More than 50,000 new cases in the U.S. in a single day, the most yet. And worldwide, there have been 6 million new cases in just the past month. Now, even New York, where the cases have been declining, putting a pause on indoor dining.
And we know that the South and West facing rising hospitalizations and those long testing lines. As FEMA warns, the testing supply chain is under strain. Matt Gutman is in California for us with the very latest. Good morning, Matt.
Hey, good morning, Robin. Those numbers really are staggering, which is one reason labs like this are working 24/7, and another reason that governors are rolling back those reopenings. Now, California's governor here taking drastic measures, saying he's coordinating state agencies, including the California Highway Patrol, to strip businesses of their license and counties of their state funding if they are non-compliant. Anything to stop the onslaught.
This morning, that alarming new record. More than 50,000 positive COVID test results in the U.S. reported just on Wednesday. The explosion in demand for tests leading the president's testing chief to warn that labs are being pushed to the very brink.
That is absolutely correct, that some labs across the country are reaching or are near capacity.
June, a devastating month in the fight against the virus. A quarter of the world's cases are now here in the U.S., where coronavirus relentlessly gained ground after states began easing stay-at-home restrictions. Now, more than 40% of the country reversing course on reopening. In California, nearly 10,000 new cases in just 24 hours. In Riverside County, ICUs are at 90% capacity and nurses on a 10-day strike. Conditions under COVID, they said, deplorable.
I know that the PPE shortage is nationwide, but I feel like our hospital has done an exceptionally poor job in terms of distributing PPE, maintaining our supply chains.
And the hospital losing 2 of its own to COVID.
We've known these people. We spend holidays with them. We spend birthdays with them. And it's hard. It's hard. We want to do the job that we signed up for.
Cases skyrocketing in Texas, where a record 8,000 cases registered in a single day. But Texas's lieutenant governor both downplaying his state's 2,400 deaths and dismissing the nation's top infectious doctor, Anthony Fauci.
And he has been wrong every time on every issue. I don't need his advice anymore. We'll listen to a lot of science, we'll listen to a lot of doctors, and Governor Abbott, myself, and other state leaders will make the decision. No thank you, Dr. Fauci.
First temperature check. We get our temperatures checked about 3 times a day.
But at Parkland Hospital in Dallas, where they've opened their 3rd COVID unit, one doctor telling our Marcus Moore he's facing agonizing decisions.
I'm having to choose and have conversations about which patients I'm supposed to take care of. Which patients I can't take care of because I got to take care of other patients. I can't even believe I'm having that conversation.
Arizona reporting a record high jump of nearly 4,900 cases and 88 deaths. Hospitals there, too, at the brink.
It's very hard.
Ricardo Aguirre had 7 relatives die of COVID. At one point, his parents and his pregnant wife were all hospitalized. He says his parents are still fighting for their lives today because hospitals are overwhelmed.
He was supposed to be on 10 liters of oxygen, and they neglected to put him on oxygen. So on Sunday night around 11 o'clock, he suffered a major heart attack.
He's been out of work since March, but still, Ricardo spent his last few $100s to move his mother's care to his home.
You can't put a price tag on somebody that you love, on somebody that you care for.
And you can't put a price tag on family. Now, we are in the COVID testing lab at Providence St. Joseph. This machine can spit out results in about 4 or 5 hours, other machines in about 20 minutes. But they're concerned here, as in other hospitals across the country, about running out of reagents, swabs, these tubes. And that's one reason we're much more likely to see pool testing across the country. That's using one sample to test many people. If one person comes back positive, they'll be tested individually, but it saves time and money and supplies. Whit.
A new strategy the government is looking at.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching and we'll see you in the morning on GMA.